Imagine waking up tomorrow and every tap is dry. No water bottle, no tea, juice, soup, or watery fruit. For this scenario, every meaningful source of fluid disappears. You stay indoors, keep activity low, and the room stays comfortably cool. Even then, 7 days become the race between your kidneys, your circulation, and your brain. One warning before we start. This is not a survival challenge, and there is no universal death clock. Heat, exercise, fever, vomiting, diabetes, kidney disease, age, and medications can make a person collapse much sooner. A cooler environment may slow the timeline. The order is realistic. The exact hour is not. So what happens first? Your body loses water all day, even when you do almost nothing. Water leaves in urine, breath, sweat, and stool. Normally, drinks and moisture in food replace it. Remove both, and the balance immediately turns negative. During the first several hours, sensors near the brain monitor how concentrated your blood is becoming. They trigger thirst and release vasopressin, a hormone that tells the kidneys to conserve water. Your kidneys respond quickly. Urine volume falls, and the urine becomes darker and more concentrated. By the end of day 1, thirst dominates your attention. Your mouth feels dry. You may develop a headache, feel tired, and notice that standing up makes you slightly lightheaded. Controlled studies after about 24 hours show this pattern clearly. Higher thirst, more concentrated urine, and small rises in blood sodium and osmolality. Now enter day 2. The kidneys are saving water, but they cannot reduce water loss to zero. You still exhale moisture with every breath. Your skin still loses some water, even without obvious sweating. Blood volume begins to fall, so your heart beats faster to keep oxygen moving. Watch our animated character stand up. Blood briefly pools in the legs, but there is less circulating volume available to compensate. The brain receives less blood for a moment. The result could be dizziness, a grayed-out view, or fainting. Walking becomes slower because every movement costs fluid and heat. By day 3, urine may become extremely scarce. This is not the kidneys shutting off because the body no longer needs to remove waste. It is an emergency conservation response. Less blood reaches the kidneys, filtration drops, and waste products become harder to clear. The cooling system also starts losing capacity. Sweating spends water. With less circulating fluid, the heart must work harder to move heat from the core toward the skin. In a hot room or during exercise, this timeline could accelerate violently. Body temperature and heart rate can climb together. Day 4 brings a new problem: concentration. As water disappears faster than sodium, the sodium level in blood can rise. This condition is called hypernatremia. Water then moves out of cells toward the souter bloodstream. Most tissues can tolerate some shrinkage. The brain is where it becomes dangerous. Brain cells losing water can disrupt their electrical signaling. The character may become irritable, confused, clumsy, or strangely sleepy. Speech may slow. Simple choices become difficult. Severe hypernatremia can progress to muscle twitching, seizures, coma, and injury inside the nervous system. By day 5, the entire circulation is under stress. The pulse is fast. Blood pressure may fall, especially when standing. The hands and feet can become cool as vessels redirect blood toward vital organs. Breathing can speed up. The person may be too weak or confused to search for water safely. The kidneys are now at serious risk of acute injury. Reduced blood flow limits filtration, while concentrated waste and muscle breakdown can add pressure. Electrolyte disturbances can interfere with nerves and the heart's rhythm. This is no longer ordinary thirst. It is a medical emergency. Day 6 is not guaranteed to arrive. If it does, the body may be approaching shock. Too little circulating fluid to deliver enough oxygen to tissues. Confusion can deepen into delirium or unconsciousness. The brain, kidneys, liver, and heart may begin failing together. And day 7, there is no dramatic switch that flips at midnight. In this controlled, cool room hypothetical, a person might still be alive or might already have died. Real survival depends on starting hydration, body size, food moisture, temperature, activity, illness, and access to help. The honest answer is that 7 days without fluid is not a predictable test of toughness. It is uncontrolled organ failure. The body fights brilliantly, concentrating urine, raising vasopressin, accelerating the pulse, and protecting blood flow, but every defense has a limit. If severe dehydration is suspected, especially with confusion, fainting, little or no urination, rapid breathing, or a racing heart, emergency medical care is needed. Clinicians measure sodium, electrolytes, kidney function, circulation, and mental status, then replace fluid at a medically controlled rate. Water looks ordinary because your body hides how much work it does. It carries heat, supports circulation, lets kidneys remove waste, and keeps every cell at the right chemical concentration. Remove it, and the body does not simply feel thirsty. Its operating system begins to fail, one connected system at a time.